Depression is often taken lightly and ignored by most people. Unfortunately, this is proving fatal mainly for HIV patients. According to findings under Building a Case for the Integration of Mental Health Services into HIV Care in Uganda by Mildmay Uganda, Rand Corporation USA, Makerere University and Ministry of Health, over 56% of people receiving HIV care in Uganda struggle with depression. The most common symptoms of depression include difficulty sleeping, not wanting to sleep, always feeling tired, sadness, and feeling weighed down with troubled thoughts. Dr. Glenn Wagner, the principal investigator Rand Corporation, explains how depression reverses the fight against HIV/AIDS.
A loss of motivation to take care of oneself and others, lack of confidence in being able to negotiate condom use with your partner, but to that sense of just kind of a loss of motivation to think about one's health and well-being.
Unfortunately, due to the prevailing mental health illiteracy in Uganda, Professor Segane Musisi, a psychiatrist at Makerere University Medical School, says Ugandans remain vulnerable to imposters since majority cannot differentiate mental illness from witchcraft.
Mental health literacy is very low in our community, and unfortunately, other people are taking over that care. So we get lots of faith healers, lots of traditional healers, lots of quacks who are always advertising on television even, telling you how they're going to cure all your problems with one single maneuver. And you wonder about even why we are allowing them to misdirect the people.
Researchers are now calling for the integration of mental health into HIV care in Uganda to avert the situation. Unfortunately, Uganda has only 30 psychiatrists, a number that is too little compared to the challenge.
We can use general health workers to identify the patients. As you have heard, we have very few psychiatrists and very few psychiatric clinical officers. Our schools train many psychiatric nurses, but our establishment does not have the funds. The wage bill, even if we had all the many treated, our wage bill cannot accommodate having all these specialists at all the levels where we want to have them.
But we chose to work solely with antidepressants for this study because we felt it was the most scalable in terms of it's a treatment that nurses can be trained to provide and is not going to be as time-consuming or require as another level of training in terms of being able to provide them with the counseling, psychotherapy type skills that would be required for other modalities.
Health experts reveal that depression can further facilitate HIV transmission by lowering the motivation and confidence to use condoms, as HIV victims consider themselves beyond redemption, therefore having little motivation not to infect others. This follows another report by the Ministry of Health indicating that mental health illness is on the rise.